People think I'm usually out there trying to buy drugs or sell drugs. Now everybody knows me, if not they know of me. And so it's like, you're the guy with tattoos helping people. I'm like, yeah.
There's a lot of folks on the Metro that need services that we can't give them as security officers, as Metro Transit staff. And so I conceptualize the Metro Transit program as it is today.
We focus on those who are unhoused and who we think are struggling with addiction, alcoholism, mental health.
Public safety is not just about security personnel, it's not about security technology, but it is the integration of services and providers that can help support the total needs of the ridership.
When we first started, we started realizing that we're engaging with a lot of people who don't have anything. So we bought like granola bars, water, some like baby wipes, what we thought were basic essentials. And then felt, well, we need to actually give them something that they own, that they can carry stuff in.
These are the backpacks that we provide to riders who don't have anything.
We typically always have a box of Narcan in the backpacks. We always make sure that they know how to administer it.
This is a female hygiene kit, you know, female products.
We do include fentanyl test strips.
And there's so much more. There really is. There's so much more.
We were founded in 1973 by just a couple of concerned citizens who identified a growing need in the community for detox services. And since that time, we've just grown exponentially. We are in 8 locations throughout Illinois and Missouri. We serve over 20,000 patients a year. We offer 5 core service offerings, so primary health care, substance use prevention, treatment and recovery, mental health care, housing for the mentally ill, and then we conduct research. And we are launching dental later this year.
There's a very comprehensive training plan for the staff. The National Council for Mental Wellbeing provides mental health first aid training in the United States. So I underwent the training to become a facilitator. And so the goal is for us to be able to train anybody and everybody who is engaging with individuals on the MetroLink and on Metro property to be able to respond to those who are symptomatic of mental health in a very proper way without escalating situations or causing more trauma.
Chestnut is really good at not being afraid to try different things to give greater access to individuals. We really strive to hire people with lived experience because from the beginning, I thought that would be key.
The MetroLink project gives me a chance to help others as I was helped. I was offered help many times and I was not ready. That's one of the reasons why I enjoy working on this project.
Such a unique project in the way that it's working with law enforcement, it's working with the security teams on the transit system, and it's providing riders resources that they just weren't getting.
The Get Help app is a platform that we use to notate engagements that we've had with individuals. Also, we're able to look at all of the shelters available that we work with and then create referrals through that app.
Both the security personnel and the law enforcement teams have embraced this process wholeheartedly.
My goal is to have teams out there day, evening, bus stops, on the train. I have big plans for this project.
I had no idea that we'd average more than 1 life a month being saved.
I do hope that it expands. Not only are we receiving positive effects, some of these individuals in need have a residual positive effect back into the community.
After getting out of prison, this was my opportunity to get out amongst the people and let them know there's another way of living. You know, there are organizations out here that do care, that do want to help. And if I can do this, anybody can do this.